Assalamu alaikum. This is Dr. Vakas. Welcome back to another video. This video is basically the continuation of previous interview series videos. In this video, I'll be telling you specifically how to prepare for an interview. In the previous video, I've told you what will happen in an NHS interview, what are the segments of an NHS interview, the things which will happen in an interview, and what are minor tips. If you haven't watched this video, don't forget to watch this video. I'll put the link in the comment section as well. So in this video, I'll be telling you the strategy, how to prepare for an NHS interview, how to crack an NHS interview. So let's start. So for preparing an NHS interview, for example, you go the interview and you have like 15 days or 1 week at least. So you have to give this period of time to your interview in order to pass that interview. It's not like you will go there, just talk with them, answer their question, you'll pass the interview. It's not like that. Please don't make this mistake. Prepare for your interview very well. Okay, and you have to follow the specific strategy which I'll be telling you now. As in my previous video, I told you there are 7 segments of an NHS interview, including the introduction, the clinical scenario, the ethical scenario, behavioral questions, and a stress question, your career perspective questions, and the questions you should be asking in the end. So how to prepare and where to prepare for all of these things. So first resource I'll be telling you is Dr. Raja Adnan's videos. What is that? So you have to simply go to the YouTube and write Dr. Raja Adnan interview questions or interview videos. So you will find a YouTube channel there, and there will be almost like 20 to 25 videos regarding the NHS interviews will be on that channel. So what you need to do is, if you got any interview, you have to watch 20 videos. In these videos, you'll find the answer for the introduction question, ethical question, scenarios question, also the NHS trust-based question, your career-wise question, also the question you should be asking in the end. All of these questions will be answered and will be found in those Dr. Raja Adnan's video. So don't forget to watch those videos. There are 20-25 videos. Just make sure while you're watching that video to prepare the notes alongside so that you can modify your answer according to your own perspective. Okay, so the first resource is Dr. Raja Adnan's videos on the YouTube, and the second thing will be there are specific books for NHS interview. I'll be providing the groups for free. I'll put the link in the comment section, so don't forget to check that as well. So for those books I'm giving you in the link, you simply just have to open the box. In those books there will be different segments for different answer with different tips for NHS interview. You can simply download the book in the PDF form and start reading the book. Okay, so with the help of these two resources, Dr. Raja Adnan's video and the interview, which I'll be providing you free in the video description, I think you will be good to go for your interview. But there are a few other things which I would like to mention. So most of the people are concerned about the interview questions. So I'll tell you. So first of all, the introduction question is very simple, like tell me about yourself, tell us about yourself. You can prepare the answer for this question before the interview in a long paragraph. Just write the paragraph and cram the paragraph, because once the interview start, you can give the answer very confidently. Okay, don't sit in front of them and think and then answer. So you have to prepare this question specifically. For the second question, which is the clinical scenario based question, it's a hurdle as well, I know. For that, I'll give you another tip. So there is a website, I'll put the link in the comment section. It's called as Umar's blog. So it's a website created by one of the doctors in which he has shared the blogs regarding the interviews and other stuff related to the lab. So you have to ignore everything else, just focus on the interview part. When you open the commonly asked question in the Umar's blog website, you will see like 20 to 30 scenarios in which the doctor is doing the interview, which questions are asked by the consultant, how the doctor responded. This will give you an idea what type of clinical scenarios can be asked from you in an interview. Okay, so this is the third resource which will help you to prepare for a clinical scenario question for an interview. If you are still confused and you are still not confident that what other things you can prepare for your clinical scenario, you can always check Oxford Handbook of Emergency Medicine, or you can specifically read emergencies of the specialty for which you are shortlisted for. For example, you are shortlisted for emergency medicine. You can search for the common emergency medicine cases, and you can prepare those cases alongside. For example, if you are shortlisted for surgery, you can search for commonly asked clinical scenario for surgery on the Google. There will be multiple scenario, you can prepare that as well. But the best resources, Umar blogs, and also the Oxford Handbook of Emergency Medicine, General Medicine, General Surgery, according to the specialty you are shortlisted for. Okay, but I'll give you the answer as in general. If someone asks you a question, any clinical scenario, how would you answer? Okay, so if there is any clinical scenario, for example, you have been asked that there is a patient in a ward and one of the nurse asks you to go and assess the patient, what will you do? So to answer this question, the diagnosis is not important, the management is not important. The important thing what the consultant is looking for you, either you know A to E assessment or not. So what is A to E assessment? So I'll give you an answer to that question. You guys will understand what I'm trying to tell you. So if the patient is sick, what I'll do is I'll make sure if there is any sick patient which is under my care that needs urgent priority before that patient. So I'll make sure my patient and my duties are handed over to a specific person. Then I'll go to the other patient which nurse informed me about. I'll go to the patient and I'll start my assessment. How I'll start my assessment, it's simple. What I'll do, I'll go and see if the patient is breathing or not, if the patient is talking or not. If the patient is breathing and talking, I'll start my A to E assessment. If the patient is perfectly fine, you can start by taking history. And if the patient is not fine, the patient is not able to give the history, you will straightly jump towards the A to E assessment. A for airway, you'll check the airway. If the patient is talking, airway is intact. You check the breathing, you will check the circulation, you will check the disability, you'll check the exposure. So I'll do A to E assessment. After doing the A to E assessment, these are the investigations which I'll do. I'll take bloods, urea electrolytes, I'll send for the renal functions, I'll send for the liver function test, I'll check the blood culture. So you have to answer according to the scenario they will give you. But the point is, don't forget to mention A to E assessment. So whenever the clinical scenario is asked, your answer should be A to E assessment. After doing the A to E assessment, what you will do, you'll inform your reg. Okay. So this is what the NHS consultant is looking for. Either you are going to do everything by yourself or you'll involve someone. So you'll mention, after doing this, I'll involve my reg, and after involving and discussing with my reg, this is how I mention the patient. Then the consultant can ask you, what are your potential diagnoses? So if the consultant asks you, what are your potential diagnoses, you have to give 2 or 3 diagnoses to the patient. So you have to make sure you are ruling out the most common diagnosis. Okay. And after that, consultant can ask you, according to you, the diagnosis is this, how will you rule out this condition? So you have to answer accordingly. But if any clinical scenario is asked, the summaries, don't forget the A to E assessment. Okay, so this is how you prepare the clinical based scenarios. For the ethical scenarios, you can search multiple ethical scenarios in the books, which I'll be providing in the description. For the NHS trust based answer, you have to go through the website, for example, the trust website, and go through their trust values. Or the second thing I can do is go through the job advertisement and I can search for the NHS trust values over there. Okay, so the next question is about the career based question. You have to prepare that answer according to your career. That are your career perspective. You can find question like this in Rajadran's video and also on the books which I'll be providing you. And also the behavioral question, you can find the behavioral question in the books which I'll be giving you as well. And lastly, about the question which you can ask in the end of an interview, I've mentioned these questions in my previous video as well, but still you can find the answer to this question in Dr. Rajadran's video in the book which I'll be sharing you. So the most common resources which I use to prepare for my interview is Dr. Rajadran's videos, and then the book which I'll be giving you in the description. And the third thing is Umar blog, just to get myself aware of the scenarios, clinical scenarios. So these are the 3 resources which I use. I didn't study any Oxford handbook, but if you have time, you can study for it. But because I felt confident at that time, but if you're not confident, I would like highly advise you to go through Oxford Handbook of Emergency Medicine just to have an idea about emergency cases. So these are the 3 resources which I use for my interview, and this is what I will suggest you to use for your interview. If you do this, inshallah, you'll pass your interview. If you still have any question and queries, you can put that in the comment section and I'll try to help you and reply you as soon as possible. Inshallah, I'll see you in another video.